Good afternoon and welcome to the Assembly of Osteopathic Graduate Medical Educators webinar series. We are pleased to have you join us for this GME Development Series webinar hosted by AOGME and AACOM Government Relations. This webinar will highlight GME expansion opportunities funded by the Department of Veterans Affairs. I am Julie Crockett, Director of Government Relations at AACOM, and I will help facilitate this webinar. Before we get started, I would like to review a few housekeeping notes. First, this webinar is being recorded. The recording will be posted on the AOGME webpage shortly, as well as other AACOM websites. All webinar participants are in listen-only mode. If you experience technical issues during the webinar, please use the chat feature and we will gladly assist you. If you have questions for the presenter during the webinar, please feel free to submit them during the Q&A feature at any time. If time permits, at the end of the webinar, Dr. Schilla will respond to your questions. And now I am pleased to introduce our presenter. Dr. Ryan Schilla has been associated with the Department of Veterans Affairs for more than 10 years and currently serves as Director of Medical and Dental Education for the Office of Academic Affiliations, Department of Veterans Affairs at the Veterans Health Administration. In this role, he supports educational programs for more than 49,000 resident physicians, 26,000 medical students, and 1,000 dental students and residents. Dr. Schilla is a board-certified internal medicine physician who holds a faculty appointment at the University of Maryland School of Medicine. Dr. Schilla previously served as Director of Quality, Safety, and Improvement, High Reliability Physician Champion, and Associate Chief of Staff for Education at the VA Maryland Healthcare System. Dr. Schilla received a bachelor's degree from Pennsylvania State University and an MD from Lewis Katz School of Medicine at Temple University. He completed his internal medicine residency at the University of Maryland Medical Center, where he also served as chief resident in medicine. Thank you again, Dr. Schilla, for being with us today and for preparing this presentation. With that, I will turn it over to you. Thanks so much.
Thank you so much for the kind introduction, Julie, and thank you to you and the AACOM Government Relations team and for AACOM leadership for affording this opportunity to meet with all of you today. We truly do appreciate it. I want to let everyone know that I'm also joined today by two other members of OAA staff, Dr. Kanta Vela-Murray, who is the Chief of Health Professions Education at OAA, and Deanna Callahan, who is a health systems specialist in the medical and dental education section, who manages our GME expansion efforts. Brief agenda for today. So we're going to start off with a high-level overview of health professions education within VA with a specific focus on medical education, review GME partnerships and discuss some of the strategies that you can employ to maximize those partnerships, review the disbursement process. This is the alternate payroll mechanism where the VA reimburses academic affiliates for resident salary and benefits. Discuss how educational cost contracts can support our academic affiliates with some of the other overhead costs associated with running training programs that cannot be included in disbursement agreements. And then close with some ways that you can either establish a partnership with the VA or expand your existing partnerships with the VA through some upcoming GME expansion initiatives. It's my hope that by the end of this session, you'll be able to discuss the role of the Office of Academic Affiliations, or OAA, and the national scope and impact of VA health professions education, outline the major functions of the VA designated education officers. These are the individuals at your local VA medical facilities who have oversight over all health professions education and health professions trainees, recall key aspects of the disbursement process, and finally, describe upcoming VA-funded GME expansion opportunities. So let's start with an overview. So health professions education is one of the 4 core statutory missions of the VA. It is literally one of the reasons that the VA exists. The other core statutory missions include high quality care delivery, biomedical research, and then our 4th mission is providing emergency response to the rest of the nation in terms of crisis This most recently came into play with the COVID-19 pandemic. We have a long, rich, storied history of health professions education within VA. Our affiliation partnerships really reaches back to the end of World War II. Following the Allied victory, VA faced the imminent arrival of over 100,000 new patients without the capacity to meet their needs. And so to meet this challenge, VA struck a landmark deal outlined in Policy Memorandum Number 2, which was the policy and association of veterans hospitals with medical schools. This emerging partnership created a dynamic, talented workforce of students, physician residents, and faculty who provide world-class care to our veterans while providing training to generations of future physicians. So once this policy was adopted, within the next year, 1,600 medical residents entered VA teaching programs, and within 2 years, 68 medical schools were placing residents in VA hospitals. The expansion of relationships with educational institutions continued aggressively throughout the 60s and 70s, with nearly 100 VA affiliated medical schools. The VA deliberately co-located medical facilities with more than 70 hospitals located within 5 miles of a medical school. The 70s also saw the passing of the Teague-Cranston Act, which authorized the establishment of 5 medical schools specifically associated with the VA. And over the years, these partnerships have continued to build and build. Some of the things that OEA has been working on within the most recent decades include expanding graduate medical education by implementing the Veteran Access, Choice, and Accountability, or VACA Act of 2014. And we will soon be implementing the Maintaining Internal Systems and Strengthening Integrated Outside Networks, or Mission Act of 2018. VACA expanded GME by 1,500 FTE over an 8-year period, and Mission provides OEA with new GME authorities, which we'll outline in detail later in the presentation. And finally, OEA has supported rural health and rural health professions education in a number of ways, most notably through the development of the Rural Interprofessional Faculty Development Initiative, which just recently recruited its 5th cohort. This provides faculty with the skills to oversee and educate, oversee programs and educate within rural settings. So OEA's mission is to educate for VA and the nation. Our office has oversight over all health profession trainee programs within VA. We manage the trainee allocations to the VA medical facilities. We have approximately a $1 billion budget, which we manage to support training programs, manage all of our affiliation agreements and the partnerships with our valued academic affiliates. We provide support and education to the field, to our VA medical facilities, as well as our academic partners. And we issue the policies that govern health professions education and provide guidance around those policies. Next, we'll review some statistics. The most recent statistics that we have are from academic year 2022, 2023. I hope it's clear in looking through these statistics, just the massive, immense impact the VA has on health professions education within our nation. Within that academic year, the VA trained over 120,000 health professions trainees, with over 20,000 of those coming from minority serving institutions, such as historically Black colleges and universities. This was across over 7,700 training programs and over 60 clinical disciplines at over 150 VA medical facilities in partnership with over 1,500 academic institutions. These programs help to develop the national healthcare workforce for VA as well as for the nation at large. You'll see that a wide number of current VA staff participated in VA HPE programs, with over 70% of VA podiatrists, 75% of psychologists, 85% of optometrists, and 65% of physicians having participated in our training programs. And trainees may be directly hired to the VA. If you're doing your residency, doing your fellowship at the VA, and would like to make a career at the VA, we can directly hire you. And I have a link here for the VA careers website. Definitely worth reviewing it. It outlines all the benefits of working as a physician within the VA, something that I've done through my entire career and have found exceptionally rewarding. In terms of the trainee experience at VA, 91% of trainees were either satisfied or very satisfied with their VA training experience. And prior to coming to VA, a little over half of the trainees indicated that they were interested in ultimately working for VA. You'll see that that number jumps to 72% after they've spent time at the VA. And so we think it's really important for all trainees to experience the VA system, and a wide majority are very positively influenced and strongly considering VA employment after they have that experience at the VA. At large, 70% of US physicians have trained at the VA. Our partnerships run far and wide, with 96% of US medical schools currently affiliated with the VA. 95% of the COCA accredited osteopathic medical schools are currently affiliated. We train greater than 50,000 physician residents each year. This accounts for about 11,500 FTE. So on average, each resident that comes to VA spends about 3 or 4 months a year. And obviously there's a lot of variability there, but if you average it out, VA residents are a huge part of the VA physician workforce. Over 40% of VA physicians are residents. We also trained greater than 29,000 medical students in AY 22-23, and over 1,000 dental students and residents. We'll move on to discuss GME partnerships and what makes a really strong VA and academic affiliate partnership. As I alluded to earlier, the designated education officers are the single designated VA employees who oversee all clinical training at each VA medical facility that either sponsors or participates in accredited training programs. You may also hear DEOs referred to as Associate Chiefs of Staff for Education, or AACOS. They have expertise in graduate medical education and health professions education. Mostly this is a physician role. If you have greater than 20 GME FTE at your facility, chances are it's a physician. At some of our smaller sites, it may be a nurse or associated health professional that fills this role. And you can see on the right-hand side of the screen the various responsibilities that fall under the DEO and the Health Professions Education Office within VA. They're responsible for disbursement and all of the fiscal procedures to make sure that the academic affiliates are compensated timely and accurately and fairly, that they maintain very positive relationships with academic affiliates. A big part of their job is ensuring that the trainees are onboarded and offboarded appropriately, and that they have everything they need to start their rotations on time. They have a policy compliance role and ensure that their facilities are fully compliant with the health professions education policies that OAA develops. They manage position allocations and HPE expansion within the facilities. And so if you have programs at the VA and you'd like to expand those, or if you'd like to start a new program, all of that goes through the DEO office. And finally, they're responsible for ensuring that health professions trainees have adequate supervision and support during all of their VA rotations. If you don't know who your local DEO is, if you'd like for me to help you connect with that individual, please send me an email after this presentation. I'd be more than happy to foster that connection. And the Health Professions Education offices are undergoing some significant change right now. OAA and Workforce Management and Consulting, that's the National Human Resources Office for VA, have been collaborating over the past several years to systematically strengthen the health professions education workforce. And for the very first time, we're proud to report that we're going to have, or we do have, mandatory staffing products. So there are standardized organizational charts and reporting structures for these offices. We have nationally standardized position descriptions and functional statements for all of the different roles within the office. National performance standards, making sure everybody's held to the same kind of standard of performance. Staffing benchmarks, which are based off of the total number of VA paid or disbursement paid FTE, trainee FTE in the office, as well as the total number of trainees, both paid and unpaid, within the facility. We've developed some complexity levels, and so all offices are going to be able to are going to be required to hire and then maintain certain minimum staffing levels to ensure that they're set up for success and are able to successfully handle all the key functions of their office. We're tracking all of these positions nationally, and we do have standardized job analyses and announcements for people to hire into these positions. So this is what a VA HPE org chart looks like, and the various positions that you'll be working with. Once again, the DEO is in charge of leadership and strategy. At about half of the facilities, they'll be required to have a deputy DEO to provide some additional leadership support and also be there for succession planning in case the DEO moves on to a different role. We want to make sure that there's a smooth and seamless transition. There's HPE managers, which are in charge of the day-to-day operations, as well as the supervision of the staff. The HPE analysts will handle disbursement, funding, and data analysis. We'll have a large number of specialists responsible for onboarding and offboarding and maintaining the affiliation agreements, as well as some program support to provide across the board admin support. And the idea with this project is to centralize as much as possible the funding elements, the onboarding and offboarding elements within the DEO office, so that the DEO and their team are directly handling all of these matters. And so facilities have through the fall to meet these benchmarks and to hire these positions, transition existing staff into these new kind of standardized roles. And so chances are, when you're working with your VA medical facilities, you'll be introduced to additional new staff members, and they'll be going through a period of transition and change. But we're very confident that over time, this will allow us to strengthen our relationships with our affiliates and lead to improved processes and improved experiences for all involved. GME within VA. So VA medical facilities do not hold the accreditation for GME programs. We serve as participating sites, not sponsoring institutions. And so we have to establish affiliation agreements with ACGME accredited sponsoring institutions. And I want to emphasize that they do have to be ACGME accredited to rotate at VA. We do not allow for non-ACGME accredited programs and trainees to rotate within VA medical facilities. The one exception to that is the VA does have some advanced fellowship programs, some non-accredited, nationally approved programs developed by the VA that do rotate at VA. The VA is responsible for providing faculty supervision, as well as a strong clinical learning environment. And we reimburse affiliated sponsoring institutions for any resident rotations that occur at VA. We are the second largest funder of federal funder of graduate medical education within the United States, second only to CMS, Medicare, and Medicaid. You see that HRSA also is a funder with their teaching health center, GME programs, and their rural residency development programs. And the DoD, of course, has their own GME programs as well. If you're wondering, is there a VA medical facility near me? Is there someone that I can sponsor with? The answer is yes. I know you can't appreciate any of the detail on here on this kind of big map, but all the blue dots, the big ones are the VA medical facilities, the hospitals, and the smaller stars are community-based outpatient clinics. And so there is a VA likely within striking distance of where you're at. And if you're wondering which facilities are nearby, once again, we'd be happy to provide that information. The DIO and the DEO really need to have a strong partnership for all of this to work. There's a couple strategies that can be employed to strengthen those partnerships. First and foremost, important to have regular meetings on the books Whenever I was a DEO at VA Maryland, I met with my DIO regularly. Make sure that you're very accessible, that on a moment's notice, if you need to reach each other, you know how to get in contact. The DEO should serve on the Graduate Medical Education Committee or GMEC at the affiliate, as well as potentially on GMEC subcommittees. It's the DEO's responsibility to communicate as much as real time as possible about VA initiatives, policies, and allocations. And the VA is here to participate in GME orientation. And actually, the VA can reimburse up to 2 full days of GME orientation when residents start their new training program. The caveat is that information has to be relevant to their experiences at the VA. The VA cannot reimburse for education or orientation around policies that only impact their time at the affiliate. The program directors, site directors, faculty also play a key role in building these GME partnerships. Really important that the schedule for the academic year is communicated ahead of time before the beginning of the year, as well as beginning of each subsequent month, so that everybody kind of knows who's rotating and when, and that everyone's on the same page. And if any planned or unplanned leave comes up throughout the course of the month, that's communicated to all parties involved. If there's an issue with a resident on their affiliate rotations, really important to let the DEO know about that, to let the site director know about that, because those problems or issues could be recurring and impact their time at the VA as well. If there's any issues with the VA learning environment, important to communicate that across the board. Discussions around allocation planning and appropriate use of positions should occur at least once a year with the DEO, the DIO, the program director, and the site directors. That's management of the currently allocated positions. If you need more positions, we'll talk about later our GME expansion initiatives. Those applications should be very collaborative between the VA and the academic affiliates. And then the maintenance of the educational activity records is a team effort, and we're going to talk at length about that here in a moment. VA affiliation partnership councils, or APCs, you may or may not be familiar with this. This is a statutory requirement of VA. The APC is the official formal forum for affiliate and VA academic leaders to meet and discuss strategy, to discuss operational issues, to map out the future of these partnerships. There are work groups that are formed under the National Academic Advisory Council. This is the National VA Council, which advises the VA Secretary, Dennis McDonough, on relevant issues related to academic affairs. And the roles of the APCs are strategic management planning, oversight, and coordination. Any recommendations that come out of APCs go to the NAC, to OAA, and other VA leaders for their consideration. And it's really designed to make improvements based on the feedback of the affiliates, the educational leaders within VA and at the affiliates, and from the trainees themselves to improve the educational programs within VA. GME is governed both within VA, both by OAA policies. You see that we have specific policies dedicated to supervision of residents, to our disbursement agreements, and generally for the education of physician and dentists. I have the link there that you all can visit to review our policies. And we abide by the accreditation standards set by the AACOM for GME. And as much as possible, we try to align our OAA policies with those accreditation requirements by the AACOM. Of course, we need to abide by all federal regulations at all times, and federal law supersedes at all times. Next, we'll talk about the disbursement process. Once again, disbursement is the alternate payroll mechanism that allows VA to reimburse academic affiliates for resident salary and benefits. We have a directive on disbursement. We also have a standard operating procedure, which gets into the more granular details of how we execute disbursement agreements. This was last published last year for the new academic year. We have some minor changes that will come out for this year as well. So here's a graphical representation of the disbursement process. The Office of Academic Affiliations provides the position allocations and provides the funding to VA medical facilities for GME. Those facilities then pay for resident rotations at the VA through disbursement to an ACGME accredited sponsoring institution. This sponsoring institution is the one that hires the residents and pays the residents, and then sends the residents for their rotations at VA facilities. What can the VA reimburse? Quite simply, it's care for veterans on VA grounds with VA funding. And so we're talking about clinical and educational activities that occur on site at VA. VA can't reimburse for affiliate rotations that occur at affiliate hospitals. There are a few prerequisite GME agreements that need to be in place to allow your residents to rotate at VA. First is the affiliation agreement. This serves as the foundation for the partnership, contains all of the legal language that governs the agreement. The disbursement agreement is the legal document that handles all of the different funding aspects. The program letter of agreement is between the sponsoring institution and the VA. This spells out who the supervising faculty are, what are the learning objectives within the VA. Sometimes we'll have that supplemented by an addendum that provides some additional details of their VA experiences. And then you need a rate schedule. This outlines the salary and benefits for physician residents at each PGY level, and determines our calculation for our reimbursement to the affiliates, and sets our daily rate of reimbursement. Once all of those are in place and residents are rotating at the VA, their time and attendance needs to be tracked through education and activity records. Many of you are likely familiar with these on the call. Here's a screenshot of our tracker. You see the residents' names are input to the left, has their PGY levels, their rotations, and then the site directors or the disbursement coordinators within the VA track resident and time and attendance by day, indicating whether they're present that day, or if they're participating in didactic activities, or if they're working on an affiliate rotation. VA rotations can either be full-time or split. In a full-time rotation, the resident spends the full rotation exclusively at the VA. To be reimbursed full-time, residents have to spend a minimum of 40 hours per week at the VA. Obviously, the residents need to have the mandatory time off from the ACGME, and they can have a maximum of 8 days off over a 4-week period to be considered full-time. We also do allow split rotations where the VA is, or the residents are spending their time both at the VA and at other sites. We prefer this to be on a fixed schedule where we know ahead of time where the residents are going to be on which days. And for instance, the resident is going to be rotating Monday, Wednesday, Friday at the VA, and will be at the affiliate on Tuesdays and Thursdays. It's a lot easier to kind of track activities and reimburse based on those fixed schedules. We also, in some situations, accommodate variable split schedules. Oftentimes we'll see this for internal medicine subspecialties where they're assigned to both VA and the affiliate at the same time, and depending on the workload of that given day, we'll spend more or less time at the VA depending on the clinical workload. That it is much more difficult to track that, but that is an option that we employ at some sites. Didactic activities are reimbursable. These have to be specified in advance, as well as required of all residents in the program. It has to be necessary and relevant for VA duties. And so if it's a didactic on a pediatric topic that has no relevance to veterans, that's not something that we can reimburse. That doesn't provide value to the VA. It is permissible for residents to be off-site attending these didactics at the affiliate with two conditions. First, the virtual transmission is not an option. They can't participate or attend this virtually from the VA, or if their interactivity requires their physical presence. And the VA provides proportional reimbursement for resident time spent at the VA during the month. Once again, rotations do have to be on-site at VA. Trainees have to be physically present at the VA medical facility while participating in reimbursable VA clinical activities, or have an OAA approved waiver request if they are not on site. We do grant these exemptions in very limited circumstances. OAA has to approve these. So the DEO would submit these requests to OAA. We would then review that and approve or disapprove those requests. And we don't allow off-site rotations just for convenience of the trainees. There has to be a legit reason that they need to be off-site. Telehealth activities are reimbursable. Once again, residents must be on site for this. Off-site requires OAA approval. That supervision can be direct or indirect or virtual. So it is acceptable for the supervisors to be off-site if the residents are engaged in a telehealth experience, but the residents do need to be on-site. In terms of scholarly activities, full-time rotations where they're doing either research or quality improvement initiatives are reimbursable, are allowable. Once again, this has to be an accreditation and a program requirement required for all residents in the program and proportionate to the scholarly time at the affiliate. It has to be relevant to veterans. And once again, offsite approval is required by OAA. So those are the things that we can cover through a disbursement agreement. There are some additional things that we can cover through educational cost contracts. Educational cost contracts, or ECCs, are designed to reimburse a reasonable and proportional share of operating costs of accredited physician and dental residency training programs. VA is given this authority through the VA Healthcare Resources Sharing Authority, as well as VHA Directive 1410, Healthcare Resources Contracting. The funding mechanism for this is the Veterans Equitable Resource Allocation, or VERA, Education Support Supplement funds that all facilities have. VA medical facilities are provided funds for each physician resident full-time FTE to support the training programs within that facility. Educational cost contracts support specific healthcare resources which are required to maintain accreditation of physician or dental residency programs. They support the function of the residency programs and the associated overhead costs. There should be a single contract for all programs within a single affiliate. So you should not have separate contracts for internal medicine, general surgery, psychiatry, et cetera. They should all be covered under a single educational cost contract. There can't be overlap with the disbursement agreement. So under no circumstances can educational cost contracts reimburse for resident salary or benefits. And these cost contracts need to be completed by a VA employee and approved by OAA. So if you want to go down this road, obviously the affiliate will play a large role in kind of communicating these costs to the VA, but affiliates should not be directly filling out these worksheets and submitting these cost contracts directly. Educational cost contracts reimburse academic affiliates for the reasonable and proportional share of selected costs of operating HPE programs. These are sole source contracts, which means these do not have to be competed. We can contract directly with our affiliates. All of these contracts contain a base year and can include up to 4 option years, so that once you do these agreements, they're good for 5 years total. And once again, they're functionally distinct from disbursement agreements. Here's a list of allowable expenses which can be included. We won't go through all of these, but highlight a few of them. We can pay our proportionate share of accreditation costs to the ACGME for parking if parking is not available at the VA. Program management software, so MedHub, new innovations. We can't support our proportionate share of that as long as that software is available to the VA staff. In-service examinations, program match fees. So not match fees for each individual resident, but the fees that the programs pay to participate in the match. We can cover select recruitment costs. We can't cover meals and entertainment, but we can cover some other costs related to recruitment. And any kind of other required simulation or training experiences, which can't be offered by the VA. In terms of non-allowable expenses, falls into two categories: program costs and individual resident costs. In terms of program costs, we can't cover any kind of administrative program expenses at the affiliate site, cannot cover salary and benefits of affiliate-based faculty. This includes the program director salary. Cannot cover malpractice insurance coverage at the affiliate. When residents rotate at the VA, they're covered for those experiences by the Federal Tort Claim Act, and so we don't cover affiliate malpractice insurance. And once again, we can't cover recruitment or orientation expenses that involve meals, travel, or entertainment. We also can't cover individual resident costs, so we can't pay for your residents' individual board certification fees, any kind of books or travel funds that they're granted, their own personal licensing exam fees or registration fees, and can't cover anything that at the end of the day becomes the personal property of the resident. So next, we'll talk about some ways that you can either start a new partnership with the VA or expand your existing partnerships with VA. And in doing so, we'll review a few requests for proposals opportunities which are on the horizon. First, we'll talk about a general GME expansion RFP. This will be launched later this month. It will be inclusive of all ACGME accredited programs and all specialties. We will be prioritizing psychiatry and the associated subspecialties such as addiction psychiatry and primary care, so internal medicine, family medicine, and geriatric medicine. But once again, accepting applications across all specialties, and we want to build our programs in all specialties. The application window will open this month and will be open through the end of the government fiscal year, which is September 30th of 2024. These positions will be awarded in December at some point for an academic year 25-26 start date. So residents will start in July of 2025. These applications must be submitted by the VA DEOs, but will be done in collaboration with the academic affiliates. And these GME expansion RFPs will be offered now on a continually recurring basis with 2 cycles of applications and awards annually. So traditionally, OAA has offered RFPs on an intermittent time-limited basis. So maybe once a year during a 60-day period, there would be an opportunity to apply for programs. We're now trying to maximize our window to apply, maximize the opportunities to partner with our affiliates. And so you'll be able to apply for positions on a continuous basis now. And here's a snapshot of what those timelines will look like. You can see in green are the application windows. In blue are the windows where we review and award positions. And then in yellow, we have the position start dates. So this first RFP cycle will be open from this month through the end of September. We'll then review and award those positions for a July 2025 start date. September 30th, this first application window will end, and then our next application window will start. So this first application windows for AY 25-26 start dates. Starting in October, we'll begin to accept applications for AY 26-27 start dates. We'll have 2 rounds of applications for AY 26-27 and for all subsequent academic years. Next, I want to talk a little bit about the Mission Act of 2018, Section 403, Once again, that stands for maintaining internal systems and strengthening integrated outside networks. The Mission Act authorized the pilot program on graduate medical education and residency. This pilot program must include no fewer than 100 resident physicians at covered facilities. Typically with our requests for proposals, when we talk about resident physicians, we're talking about FTE, but for this act, they're actually talking about 100 individual residents rotating at covered facilities. So this will authorize these residents to rotate at covered facilities, which include those operated by Indian tribes or tribal organizations, those operated by the Indian Health Service, federally qualified health centers, and Department of Defense facilities. It will reimburse select costs, and this initiative ends August 7th, 2031. In terms of selection criteria for covered facilities, there has to be a need for providers in the areas surrounding the facilities. The local community has to be designated as underserved by the Secretary of the VA, and facilities should be located in a health profession shortage area or rural or remote areas. The Act authorizes a number of covered facilities that we listed previously. Our priorities through these RFPs are rotations at Indian Health Service facilities, those operated by Indian tribes or tribal organizations, and those in communities designated by the Secretary of VA as underserved. And so Section 403 of the Mission Act granted the VA with two new authorities. One is that we are now able to reimburse for resident time, that being resident salary and benefits, for delivering non-veteran care in non-VA facilities. You'll recall through the disbursement process, traditionally we only reimburse for care for veterans on VA grounds using VA funds. The Mission Act now allows us to also reimburse for rotations at the covered facilities. It also allows us to reimburse for the startup costs of new residency programs at non-VA facilities. And so we'll spend a little time reviewing both of these models. So in Model A, the VA reimburses the GME sponsor for salary and benefits of residents rotating to covered facilities. So the Department of Veterans Affairs will provide the reimbursement directly to the affiliated GME sponsor who hires and pays the residents. The sponsoring institution will send the residents to rotate at a covered facility, such as an IHS or tribal facility. Under Model B, the VA reimburses covered facility GME sponsor for new program startup costs, as well as the salary and benefits of residents. So a covered facility will sponsor a new GME program, and the faculty and residents from the new GME program at the covered facility, select costs will be reimbursed by the VA. That model will be introduced later. This year, we're going to be releasing a request for proposals for Model A only. That will be released later this spring or early summer. This will be for positions starting in academic year 25-26. The sponsoring institutions will apply directly to OAA and complete those applications in partnership with a covered facility. And so once again, those covered facilities are Indian Health Service, tribe and tribal organizations, federally qualified health centers, and DoD facilities. So in closing, I want you to remember that the VA operates the largest platform for health professions education and is the second largest funder of graduate medical education in the nation. Health professions education is one of the 4 core statutory missions of the VA. It's one of the drivers of everything that we do at VA, and one of the key priorities of VA. These programs help to develop the national healthcare workforce. The oversight of health professions education is done at the national level by the Office of Academic Affiliations, or OAA, and by the designated education officers at the VA medical facility level. Once again, if you don't know if you have a VA medical facility near you, or you don't know who your designated education officer is at your local facility, please reach out to us. We would love to help foster that connection. Disbursement reimburses academic affiliates for resident salary and benefits for time spent performing authorized VA clinical and educational activities. And there are multiple VA-funded GME expansions and opportunities for partnership on the horizon for our request for proposal process. We will certainly share those opportunities with AACOM leadership and truly hope that you do take advantage of those opportunities and work to build partnerships with VA. If you have any questions related to medical and dental education at VA, the best way to reach us is through OAA Medical Dental at va.gov. That'll send an email to the entire medical dental education team, and either myself or one of my team members will get back to you as quickly as possible. If you'd like to speak with me directly, I have my email listed there as well. Thank you again for your time and attention today and for your interest in VA. I'd be happy to answer any questions that you have at this time.
Thank you so much, Dr. Schilla. We had a few questions come in, and I know your colleagues answered some of those directly in the chat and Q&A boxes. But looking at some of the other questions that members submitted through the registration process, I'll just go through some of those and then just again encourage folks to ask questions directly on the chat feature. So if a program applies and is not accepted, are they able to reapply in the next round? And does the VA provide any technical guidance or information on why and ways to improve their chances? And are those priority programs set for the duration of the program, or could there be additions or removals in future cycles?
That's a great question. Yes, we want to get to yes with all of these applications. We want to support all programs that are interested in training at the VA, as long as we have the capacity and the resources to do so. We want to make that opportunity available. And so, yes, you can reapply as many times as necessary. The beauty of this new RFP process and having these opportunities continuously available is that if you apply one cycle and you don't get awarded, you can just go ahead and apply during that next cycle. It is the DEOs that submit the applications, and so we'll be providing feedback directly to those DEOs as to how their applications could be improved and what concerns that the review panel has and how those applications could be strengthened. But we do provide mentorship to the DEOs and support to the DEOs, both during the process as they're crafting their applications, as well as after the process, providing them with constructive feedback. In terms of the priorities, we base our priorities in terms of the physician shortages areas for the VA. And right now, those shortage areas are mainly in psychiatry and primary care. So that's what we're prioritizing now. I imagine, those are two of the cornerstones of VA care. And so I would expect those always to be kind of near the top of the priority list. But there will be, we definitely review those on a regular basis. We look at those at least annually and may add additional specialties in the future. But once again, if your program is not one of those priority areas, you should still definitely apply. Our GME expansion initiatives are open to all specialties, and we want to grow all programs across all specialties within VA.
Thank you so much. And another question, what definition of underserved does the VA and the VA secretary use in the selection criteria for covered facilities? Do you know?
So it's based on the health professions shortage areas. It's, I would encourage if you have specific questions on that, if you go on the OAA website, which we can put our public website into the chat. If you want some of the more granular details related to this rule, you can look at the final rule, which was published in the Federal Register, which has all of those granular details listed within it. Dr. Vellamuri, do you have anything to add in terms of our priorities and in terms of shortage areas?
There is a list that's published by the Secretary of Underserved. So in that link that Deanna has just put, which is our information page, it has a link to the final rule there. So in that where it says VA facilities areas designated as VA underserved, it'll take you to the link to the list itself.
Okay, thank you, Dr. Villamarie.
Great, thank you so much. Another question, how many do you know, or what percentage of resident physicians, medical students, and dental students residents are veterans? Do you have any? I mean, I'm sure you might not have that off the top of your head, but I know that someone was interested in that.
Yeah, I don't have that information. I don't know off the top of my head. No, that's not something that we specifically ask whenever we're I guess that there are questions within the onboarding packets, but that's not data that we're kind of tracking centrally at the OAA level. The individual facilities will onboard their residents, and that's part of the questions that are asked. But to my knowledge, I don't think we have that information centrally. And Dr. Villamarie, correct me if I'm wrong.
Yeah, no, you're correct. I don't think we have it. But with the new onboarding system that's being implemented in VAs, we will likely get that information in the future.
Yeah, that's a good point. There is a new system called APDS, the Account Provisioning and Deprovisioning System, which is an online centralized onboarding system meant to streamline the onboarding process, which has been introduced at most VA facilities now, is now a requirement that this system is being used. And so all of this onboarding information now will be centralized. And so we may have data to report on that in the future.
Great. No, thank you so much. And this is another in the future question, but do you foresee the VA ever cross-comparing data with CMS, like for overlap purposes, and just to compare information, like being as that you both, are significant funders of GME?
Yeah, so I think you're referring to kind of our billing information and ensuring that there's not overlap or double billing between those entities.
Well, I'm not sure the full intent of the question, but it does just in terms of general like GME data. And like, will there ever be any overlap? Do you know with like CMS in terms of comparing that?
We do communicate regularly with CMS. Actually have an email thread right now on an issue that we're talking through. So yeah, we do communicate regularly with them. We don't directly compare our funding. So what's submitted on the IRIS report versus what's submitted to the VA on through EARS, those reports are not directly compared. But we do have a regular and robust dialogue with CMS around GME.
Right. They could be compared in an audit process though by CMS. So it's not a regular.
Yep.
Well, that's all the questions that I see. So I guess we can give maybe a little bit longer in case anyone needs to answer, but actually, here comes the question. Okay. Do you foresee the OAA advocating for health education in the high school setting to promote medical education and training in secondary school setting versus waiting for graduate education?
So yeah, OAA's focus is on formal health professions education training programs. That's what we have oversight over. But we do recognize that to get people interested in health professions education, you want to introduce it to them early. By middle school, high school, you want people kind of having some experiences and learning about health professions education to kind of foster that interest in them as a future career. That is oftentimes done through shadowing or observership experiences. That's not something that OAA has direct oversight over. Actually, our community development and civic engagement, or the voluntary services program office, oversees any kind of volunteering experiences for which shadowing and observership is considered, a volunteering experience at the VA. So we are working with that office to try to develop some better guidance in that area. It is something that we'd like to support as much as possible. We just don't have a strong mechanism in place right now to allow that. But that is something that we are actively working on and would like to make more opportunities available so that people are interested in healthcare and also interested in working for the VA and caring for veterans.
Great. Well, no, that's really good to hear. And thank you for that final question. If you're good, Dr. Schilla, and your colleagues, VA colleagues are good, I think we can go ahead and close, and just want to thank you again for this opportunity to hear from you and to speak with our membership, and want to reiterate that this will be posted for review later. And I know that you have included your contact information. That's very generous of you, and us at AACOM are happy to help facilitate that communication. So for those on the call, please feel free to reach out to us, and we can get you in contact with who you need to be speaking with. So thank you again so much, and look forward to continuing to work with you all.
Thank you so much, Julie. Thank you all for attending.
Thank you.